So I was talking to one of my clients this morning, and she has had some good results with her strategy so far. She's seen me a couple of times, and her issue is improving. And she kind of asked, well, what do you do? What do you see? What's your ideal client? And I kind of realised that people don't know what we do very well. We all know what physios are, we all know what chiros are, but what do we actually do? And it's a little bit concerning for me with our industry in terms of where it seems to be headed. So it seems to be headed where we are less hands-on. In some physio schools, basic hands-on skills like manual therapy is not being taught anymore, which my brain just can't deal with. I'm afraid I'm very old school. I've been a physio for so long that I can't understand how you could not use your hands to manage people. Yes, we are exercise based. Yes, we need to be functional based. Yes, we need to assess how people move, and we need to strengthen you and stretch you and give you flexibility exercises. But our core skill is being able to mobilize, manipulate soft tissue and joints to get the best results from you. And I think this is where a little bit of our industry is falling apart, because the lines are grey, the lines are blurred. We have a lot of massage therapists that I see who say that they can manage you as good as a physio can do. We have a lot of personal trainers, fitness instructors, fitness trainers who basically say, I've done a weekend course in managing back pain and shoulder issues, and you're fine, you can still work with me. And we also have a blurred line between what chiros do as opposed to what osteos do as opposed to what we do. So the lines of distinction are very blurred, because we all cross over now. There's, as a physio, we're looking at how you move, how your joints are working, how they interrelate, what the soft tissue is doing. And we've also got that add-on knowledge of stages of healing. So what do we need to do? What are the clinical implications that can affect that? So how does an ankle injury present as opposed to an ankle injury that is a ligament rupture, as opposed to an ankle injury that's a tendon problem, as opposed to an ankle injury that is a joint or a impingement problem? We have the skills to differentiate that, because if you manage a pain at the back of the heel, for argument's sake, as an tendon injury, you want to strengthen it and you want to push it into heel raises. However, if that is an impingement problem, we want to do the complete opposite. And it scares me that a lot of those with non-medical training are doing that. And at the end of the day, you know what? It's your body. You choose who you want to manage it. If you want my opinion as to what you need to do, you need to come and see me. I can't just say, yeah, ankle injury, you do this, because there is tendons and ligaments and joints and bursas and muscle and a whole heap of stuff going on, and nerves that we need to distinguish between. The exercise size of it, I will probably say that from a physio point of view is something we haven't maybe been as strong on in the past, and people see us as, you're in pain and what have you when you're doing this. So making that switch around to all the training being a bit more personal trainer based, or not personal trainer based, but being a bit more less hands-on, less manual therapy based, and more exercise and rehab based, which is, to be honest, where a lot of the evidence-based medicine comes from, because our profession and professions in general are geared towards what's proven by evidence, what's actually evidence-based medicine, evidence-based practice that's coming out. And then we go with that. So, before it was, okay, we need to do this, and we need to work our core, and we need to do this, and then it was, no, we don't need to do that, no, we need to do this, and then it was back pain, we need to rest, and we need to not move, and now it's back pain, we need to exercise, and we do need to move. And before it was posture is very important, now it's posture is not important, and it's just how you are. And you know, tomorrow it's going to be something different again. I would like to think that I manage you with my 30 years of knowledge behind me the best that you require. Not because exercise is the new big thing, not because exercise this way has been proven to work, because you're not a, what's it called, a test subject. You're not a, I can't remember when we're doing these theses, what the actual thesis is called, the process is called. Anyway, you know what I mean. You're not a test subject where we're getting a sample of 20 of you and seeing what's worked, or a sample of 2,000 and seeing who gets the best outcome, because there's so many variables. So when we're looking at what we do, the variables that I know of are, you know, if you're an ankle problem, what do you do work-wise? Are you sitting all day? And if there's 2 office workers who are sitting all day, you might not need to have that much of an ankle issue where you can run and jump and do all sorts. However, if one of those happens to be a triathlete, or one of those happens to be an F45 nut, then what we actually need to do then is ensure that you're capable of doing that, that you're capable of being able to manage that. Office worker next to you who just wants to get to work, go on the train, get in a car, walk maybe around the shops, and he's not bothered. He doesn't care about that. So what we do with the 2 of you is going to be quite different. And also, you know, in terms of feeling resistance in muscles and feeling what's going on and feeling how the joints are, we do need manual therapy. So this move away from manual therapy in our profession is very, very concerning for me. But getting back to the question I was this morning, which is what kind of clients do you like to see? Like, what is your type of client that you see? And I actually thought about it and thought, well, actually, we tend to see, or I tend to get, the clients who come to me, they might actually have a bit more than one problem. So they might have 2 or 3 issues that are interrelated. They might have had it for a long time. So I do tend to get a lot of clients who maybe have chronic illnesses or chronic issues. I do get a lot of people who have had a problem before, whether it's shoulder, knee, joint, what have you, that has not responded to other therapists. That might be their 3rd or 4th or 5th therapist that they've come to, because they're sort of going down the line going, I haven't, you know, it's just I haven't had results. And I might be that person that people come to because I do offer clinical Pilates, and that is something that is just looking at you a little bit differently. And what that means is that, you know, normal standard management, and there's not that many of us that have been in the profession over 10 years left. A lot leave before then. I don't know what the figure is, but a lot do leave. But from that sort of 30 years of knowledge, what I'm drawing on is, I know that this responds well to manual therapy. I know that this responds well to stretch. I know that this is a problem here. I know now that interrelating all of this and looking at you as a whole means that it doesn't matter what we do to treat your knee. We actually need to also take into account what's going on with your hip and your foot. We also need to take into account what you're doing day to day. And we also need to take into account what you want your body to do, because that is how you get the results. And if we're just going, that's the knee problem, just do this, but that's not allowing you to do step-ups, or it's not allowing you to run, then it's not better for you. It's better for you sitting at work, but it's not better for you activity-wise. So we need to be able to get you from here to here and work out a program or a management strategy that works. And like I say, it doesn't tend to be just a one-size-fits-all. It has to be able to be adaptable. So just in terms of being able to manage, say, something like an arthritic knee or a pain in the knee, there's 10 different things that can be wrong in the knee, probably 10, 20 plus that could be wrong in the knee if I'm honest, but there's umpteen things that can be wrong or an issue in your knee, and we need to pick the right one, and then we need to pick what needs to happen with that and how that issue interrelates above and below to allow your body to perform. And if you've had that for a long time, you will have a lot of compensations and changes and muscle imbalances that are also evident. So even when we fix your knee, if you just look at the knee, if we fix the knee and you go away and try and do something, it's going to fail again. What we need to do is look at what's going on in the knee, look at what's going on above and below the knee, address all of those issues and how it relates up and down the body chain, and deal with that. And that's where I excel. And that's why people come to me who have been to 1 or 2 or 3 or 4 different people before and not got results, because we're looking at you that little bit differently and looking at that. And that can be that you just need to move, it can be you need to stretch, it can be you need things releasing, it can be that you need manual therapy. And I love using manual therapy to actually help you. If that shoulder's stiff, I'm not just going to say go and stretch it and keep going. I'm actually going to say, okay, let me help you, let me mobilize it, let me stretch the joint, let me stretch your capsule, let me release this, let's get something moving, so that you can go, oh wow, I can now move it, now let's use it, so that you've got that extra range. Let's strengthen you within that range so that you keep it. Otherwise, you stretch it and it goes, you stretch it and it goes. How about we stretch it, we show you how to do it to keep it, and then we also strengthen it within that range so you're able to maintain it. That's where we differ. So a lot of my clients might still see or have a physio that they use or a chiro that they use if it's a simple issue. So I definitely have some clients that travel to me who come maybe once every 6 months or year or 2 years, and they come because it's something they know is slightly outside normal and it needs something that's slightly outside bog standard. I would like to think I don't do bog standard, so I would like to think that what we do is, you know, a little bit different, because at the end of the day we all are different, and at the end of the day we need to look at you like we're different, unlike you're different rather, and be able to adapt that. And I'm definitely very wary of, you don't need to do this anymore because there's no evidence that it works. So I'm very concerned about we just do this because this is evidence-based, we just do this because there's no evidence to say this worked. And as I was just saying, if you need to stretch and I need to help you get that range, or I need to manually help you get where you want to be because there's something tight restricting you, I'm going to do it because I know it works. And if I think that, you know what, your posture is a problem because it's loading you and causing pressure and compressing you, and you're not aware of that, and I'm going to show you what you need to do to move out of it, and to then show you what you need to stay there and strengthen the right structures so you don't go back into that painful pattern, I'm going to do that too. So recently it's been, we don't need to do manual therapy anymore because it doesn't work, and we don't need to worry about posture because there's no good or optimal posture, there's just everybody's posture. And I'm sorry, that's just a load of codswallop. Posture is posture is posture, and pain is pain is pain. And if soft tissues can change and adapt because we can mobilize them and change them to change and adapt, all I then need to do on top of that is get you improved and then show you how to keep that way and stay that way. So that's what I do. I can see everything from the basic acute size to neck aches to backaches to shoulders to hips to God knows what, but I tend to attract those clients that are after something a little bit different. Maybe it's the clinical Pilates, but they're also after somebody who is going to help them perform. So they might be athletes who can't run more than 10Ks but they want to run 20, or they get pain after this but there's nothing wrong. Or people who've been in pain for a long time and want to change it but they haven't had success with others. You're the kind of client that I get because you tend to be too hard and a bit too complex, and a bit too hurty on the brain, with all due respect. It takes a lot of knowledge and background knowledge to be able to decipher what's going on in multiple areas and get good biomechanical assessments and know what to look at and know what to look for, and also put that into a picture that makes sense. And I love doing that. And yes, my brain does hurt, and I do sort of sit there and go, please just give me a couple of minutes because I need to think and I need to just think where I need to go. But I'm trying to cram in 30 years of knowledge into an hour that I see you to come up with an outcome that I think is going to help you, because I'm very aware that by the time that type of person comes to me, you are fed up and you're pissed off and you are pretty much on your last legs in terms of, I don't know what else to do to work, I don't know what else I can do that helps, but there has to be something more. I don't want, and you do not need to put up with that if you're in chronic pain or discomfort or you want more. There's nothing wrong with wanting more, and if I can help you get more, I most certainly will. And it'll be a mix of everything. If I need to do hands-on, I will. If I need to do posture work, I will. If I need to do stretch or strength or balance work, I will. If I need to manipulate you or change you, I will. If I need to get you in using our clinical equipment, I will. Because what you need is what you need is what you need, not what evidence says you need. And what I want is quick. I want quick changes. I want quick changes. So you go, okay, if I do this, does it change it worse, better, or same? And you tell me, and then I try something else, worse, better, or same. And as long as we're getting the better and the better and the better, then you get results. And then you go, yes, there can be a difference. Well, let's work on how to keep that difference. So, who do I say? Probably in realistic terms, as a physio, anyone and anyone that needs anything changing in the musculoskeletal body system, whether that's because of pain, injury, or sports injuries or anything. Who do I tend to attract? The complex, the I haven't been helped before, I need help but no one's been able to manage it, I've been told I need to do this but no one's been able to know what pathway or what structure that looks like. That's what I do. Can I do simple? Yes, but everyone can do simple. Can everyone do complex? No. And that's what I love doing. And that's why, because it gets the biggest change. Take care. If you would like to see me, send me a message, flick me an email, or get in contact.